training. I did a 1-year preceptorship, and that's where I specialized in intravenous vitamin therapy and nutritional support for all kinds of conditions. So I'm going to talk to you a little bit about the main reason what brings people most to come to a naturopath and pay out of pocket. Number one, they're usually not getting results anywhere else. They're just getting pills thrown at them. They're not feeling well. And number two is the main chief complaint of fatigue. So I don't know too many people that don't have fatigue from time to time, or the fatigue gets progressively worse, and as they age, after age 35, hormones start declining, and it declines in both males and females. So for those two reasons, they usually make their way into my office. So the main reason of why to do an injection over a pill is because when you take a pill, most of the time you don't absorb it all. And the reason for that is most people, they think they're eating a healthy diet, but a lot of times they're eating avoid foods on their blood type. And that's based on genetics. So the different blood types should eat a bit differently. And that assesses food sensitivities from a genetic perspective. So when they're not eating the right diet, it causes inflammation in the gut lining. And the gut and the small intestines is where all of your B vitamins are absorbed. Now, when your B vitamins get depleted, it really takes a toll on the adrenal gland. And that's a little gland, it's about the size of a kidney bean, and it sits on top of your kidneys. And that gland is so important. It helps you handle stress because it's the gland that produces your cortisol. And it also makes a master hormone called DHEA. And then all of your other hormones are made from that master hormone. So if the adrenal is being taxed, the DHEA either runs too high or too low, and if too low, all the other hormones start suffering. So the reason for the injection is that it bypasses gut absorption. So the vitamins and nutrients go to exactly where it's needed. They go into the cells, get transported where they're needed, and you feel a more immediate relief. And it addresses your fatigue much more quickly. So today we are offering a couple different shots, and we have them at discounted prices today for your wellness fair. The first shot is just a B12, and for people who who are needle squeamish or don't want anything to burn or sting, this one's rather benign. It's a tiny little insulin needle. It's done at the back of the tricep. You won't even feel it. This solution does not burn at all, and the B12 is important for energy and metabolism, and indirectly can help lose weight because it helps rev up and speed up your metabolism. It's also good for cognitive function, and it tonifies the nervous system. It helps with stress via that route. It also helps with absorption as well, and indirectly it can help you lose weight. The second shot is MIC, otherwise known as methionine, inositol, and choline. They are called lipotrophic factors. So in order to break down your fat, your gallbladder dumps out its bile, because it's like a little bag, it spits out its bile, and then you digest your fat in your small intestines. So the methionine and acetylcholine helps that process. It also helps shuttle fat outside of the cellular storage so it can be burned and accessed for energy. So indirectly, this shot helps with weight loss too. Its other claim to fame is that it helps support liver detox because the liver and the gallbladder are closely related. So these little nutrients help detoxify certain chemicals that have to be broken down. The third shot, and this is for people that are super fatigued, or if you have any gut issues like irritable bowel, Crohn's disease, any scenario that would decrease your absorption, this is like a high-powered shot. It's kind of like a baby version of our IV therapy, which I'll talk about later. But this one has some B complex in it. It has some folic acid in it, and the rest of it is B12. This one does sting a little bit with the B complex, but the needle's very, very thin, and most people don't mind this sting because the benefits that it gives, you can really feel it. The folic acid component in that helps lower homocysteine levels. So homocysteine is implicated when you have high homocysteine levels, you have more cardiovascular risk. So that one helps with the cardiovascular risk. The B complex component really supernourishes the adrenal glands. And through stress, our B vitamins get depleted, and you need the various B vitamins because they work synergistically as a team. So those are the main reasons why the injection is superior to taking a pill. Okay. The other thing, and we do this in the office, is intravenous vitamin therapy. And people might say, "Oh, why? That seems, I don't want a needle sticking out of my arm. Why do it that way?" Because it's the fastest route to people that are really super, super, super fatigued. It also treats many other conditions, and if somebody's going through chemotherapy, it helps offset the side effects. It helps the immune system fight various conditions for chronic fatigue syndrome, various pain issues. The magnesium in those bags help relax the muscles. And the difference is you're just getting a lot more nutrients, a few different things that we can't really add into an intramuscular injection. The drips are usually like a 250 ml bag that drips in a half hour. And people do this preventatively. I don't know if you've heard of the drip room, but we give a really much better deal, and we stack our bags a little bit heftier. So I have my own drip room. My office is off of Osborne and Scottsdale Road. It's right in the Scottsdale Medical Pavilion. So if anybody needs to ask me more detailed questions, or if there's a condition in mind and you want to see if naturopathic medicine is right for you, I'll be glad to answer them in the conference room. And also, that's where we'll be doing these injections today. We just have you sign a little form that gives us permission to inject you. And you can do any one or a combination of these injections. The B12 and the MIC work well together. And if you're really super fatigued, you might want a double dose of the B12. We brought plenty of shots for you. And so some symptoms that might appear that would tell you that you're low in B12 is an overall lack of energy, or if you get fuzzy, you can't think of the right words, you get some confusion, persistent sleep problems. And the sleep problems really come from the adrenal gland being fatigued, and either problems falling asleep or staying asleep. The B vitamins help nourish the nervous system. So the irony is they give you energy, but they can help you sleep without making you sleepy, if that makes any sense, because it's a tonifying agent to the nervous system. Digestive problems with absorption, because your B12 is made in your gut. So if there's inflammation, it's not going to make very much of the B12. Hearing and vision loss. And as we get older, of course, we get this thing, right? Also, irritability and mood swings, because there's a big connection with the brain neurotransmitters and the hormonal system, and that can create for anxiety that you don't know why you have anxiety, like there's no external reason, but you just have these bouts of what feels like an anxiety attack, and that's usually connected with the adrenal, especially if you've never had that before. And these things really, really help. Weak immune system, getting colds more frequently, getting infections, sinus infections, head colds, and things of that nature. Slow wound healing is also another symptom. And tingling in the extremities. You know when your limbs start to feel like they're falling asleep? Well, yeah, if you're putting pressure on it, and there's a reason why the circulation is impeded, that's, that's okay. But if you're getting that symptom randomly, or if at night, your limbs and things are feeling like they're falling asleep, that's many times a B12 deficiency. And adding these vitamins in could correct for that. So people at higher risk are, as we get older, elderly, they're always deficient in the B12. People who take acid blockers because it affects the health of the gut tissue, they're at higher risk. People with ulcerative colitis or Crohn's due to absorption. Also, women with a history of infertility and miscarriages, too, are at higher risk. And vegans and vegetarians. People think that a vegan diet is good for everybody. Blood type diet says a little bit differently, but that's not as to say that you shouldn't get more raw foods and vegetables in your diet. But blood type O's make very poor vegans because they were the original carnivores, and they do need a little bit of clean red meat to be really vital. So things that you'll notice with the shots, and sometimes people don't notice it off the first shot because they're so depleted. So sometimes it takes a little build up to get your reserves up, and then sometimes people notice, wow, I really felt great off of that first shot. So most people will feel a boost, and you might get a better quality of sleep tonight. People that have chronic fatigue, they might feel the difference more readily because they're so depleted. It's B12 slows cognitive decline, and it produces acetylcholine, which is a neurotransmitter, which helps with memory and learning. So when you're fighting to get through your day and you just can't focus, it gives you a sense of mental clarity. So also B12 helps with the homocysteine levels as well as does folic acid, and again, it helps you sleep without making you sleepy. And it won't keep you up. It's not like an amphetamine or a stimulant. It's not going to keep you up at night, even if you did the shot later on in the day. So aside from weight loss, these two shots work on detox, metabolism, energy, weight loss indirectly, and mood enhancing and overall vitality. So I'm going to turn this over to you. Do any of you have any specific questions that I haven't answered regarding what we're going to do today? Yes.
I have two questions.
Yes.
Can you do all three?
You can.
Okay.
You can.
And how often, how frequently can you do them?
Most will feel an improvement if they do them at least weekly. When somebody's really adrenally fatigued or has other health conditions, I may put them on a regime of a couple times a week for a couple weeks, and then I'll taper them down to a maintenance dose. And then while we work on diet and absorption so that you start absorbing your nutrients better. Yes?
Do you do the screening part of it?
Yes, there is a test that's an intracellular analysis, because when you go to a regular doctor and they just test your B12 levels or your folic acid, it's not showing what is getting into the cell. It's just showing what's circulating at the time. So the gold standard is an intracellular vitamin analysis, and we have one that does all of the vitamins and micronutrients, and does the antioxidants, and it gives you a good idea of where you're deficient, what foods to eat to gain those vitamins, and then what supplement protocols would be best to turn the case around. Yep. Any other questions? Yes.
My husband has Crohn's, and he uses B12 sublingual nasal spray. How does that work?
How does it fare?
Yeah.
That's a better choice than a regular oral pill, because the mucosa of the nasal and or the sublingual absorbs it more quickly, but still he's only absorbing a certain amount of even that supplement. So injecting, he would feel a far better boost. But I mean, you know, on his own, it's good to continue to do that as well. Yeah. Any other questions? Questions, concerns? And we'll leave you.
Is
Yes.
there any side effects that we should be aware of?
We use products that don't contain preservatives or red dyes in them. So there's physical side effects, no. From any injection, there's always that slim
Sure.
possibility, of it getting an abscess or something. I've never seen that. And if that were to ever happen, always, call me right away, but I've never seen it happen in my practice. Yeah. And there's a little sheet with any, possible side effects that you'll look at before you sign. Yes.
There's a little trial and error on the sleep side, is that correct? When you're using your what is it?
Mice. As far as, you're saying which vitamins help with the sleep?
Longitudinally, you would ask the patient, I would suspect,
Mhm.
how did you sleep last night? We're all in real estate, so we don't sleep well anyway.
Right. Uh-huh.
It's a stress job.
Right.
But how do you determine the level of CCs that you provide and over a period of time?
Yeah, how you gauge the therapy protocol? Okay. You take into consideration, age, their diet, how long they've been on that particular diet. You take into consideration any diagnoses that they already have, any medications that they're on that could also affect absorption. And, through all of that, we can gauge with signs and symptoms if they're not gonna, do the more extensive testing. And I do this so often that I can kind of estimate how much they're gonna need, how long they're gonna need it for, and the best indicator is signs and symptoms and the patient reporting back how they're feeling as they're going along. Yes. Any other questions? And, yes.
So is it, if you start doing it, is it something you have to do like for the rest of your life kind of thing?
Well, the whole idea is to turn around the symptoms, get them symptomatic improvement, while we're buying time to educate them on the right diet so that their absorption can improve, and providing, they follow good clean diet, and they're not vegetarian, because vegetarians should continue the supplementation, and certain health conditions, until that condition is resolved, should continue the supplementation. But we kind of work on the health conditions from a holistic standpoint, so that, they're not as dependent on it, and they can just, do it for a maintenance, and maybe at home do the sprays or some other things that would be helpful. Any other questions? And we're leaving our cards. If you think of something, feel free to give us a call. I'll be glad to answer any personal questions for you, and give you information to see if what we have to offer is right for you. Thank you very much. You guys have been awesome. And thank you. I'll be in the back in the conference room, so you can come and stagger on in there, and we'll get you set up. Thank you.
I get all the shots.